Welcome again to the Chronic Pain Self-Management Past, Present, and Future webinar with Dr. Patrick McGowan, who's the Associate Director of the Chronic Disease Self-Management Program in BC. My name is Anne Gillespie, and I'll be moderating the webinar today since Tanya Hyde, our usual host, is away at a conference. I'm a project officer with the Canadian Institute for the Relief of Pain and Disability, who coordinates these webinars. And the webinar is co-sponsored by the Canadian Pain Coalition and Pain BC, and is made possible through the support of the Direct Access Program through the BC government. So without further ado, I'd like to introduce our speaker today, Dr. Patrick McGowan. We're very pleased to have him here, and this actually is the last of our webinar series on chronic pain. So it somehow seems very appropriate that we have Dr. McGowan with us, whose research career over the last 25 years has mainly focused on various aspects of health education programs for persons experiencing chronic health conditions, and especially self-management programs and strategies. He's been researching and implementing self-management programs relating to particular chronic health conditions such as chronic pain, diabetes, arthritis, osteoarthritis, and tuberculosis. As well, Dr. McGowan's been researching the feasibility, viability, acceptability, and effectiveness of a general self-management program that many of you may be aware of called the Chronic Disease Self-Management Program. And this program is offered to persons experiencing any type of chronic health condition. And the research is being conducted at the community level and at the provincial, national, and I understand the international levels. So today Dr. McGowan will be giving us relating some of his experience with how self-management programs are implemented at the community level, how self-management strategies are applied to chronic pain, and giving a sense from a case study how the self-management strategies can help to maintain a quality of life. So, Dr. McGowan, I thank you for being with us.
Okay. Well, good day, everyone, and thank you very much for the opportunity to participate in this webinar. Yes, I'm Patrick McGowan, and I'm with the University of Victoria, and as Anne mentioned, been involved with self-management programs the last number of years, and maybe within the last couple of years, chronic pain self-management. So what I'm going to do is tell you about chronic pain self-management and the strategies that seem to be working. Now, I understand that the people participating in this webinar will be some health professionals and some people actually experiencing chronic health conditions. Is that right? And as well, probably there'll be some males and females involved, right?
Yeah.
So here we go. So what I'd like to tell you about today is, first of all, a little bit about the principles of self-management programs, how they work, and then I'll introduce the chronic pain self-management program and talk about the specific strategies that are involved in the chronic pain self-management program. And then I'm going to go into an aspect looking at men and self-management, and then we'll use a case study of Bruce and sort of relates Bruce's experience with chronic pain and the self-management program. Okay? So let's just take a look at the health conditions of British Columbians. So you'll see by this little pie diagram that about 15% of the people in BC don't even use the healthcare system. About 31 people use it, but with acute conditions. And then about half the people use it for chronic conditions, and chronic conditions are the sort of the concerns of the current healthcare system. And you notice here that all we do is we mention chronic health conditions, but almost with all chronic health conditions, pain is involved. So you can see the prevalence or the amount of people experiencing pain out there. Okay? So a couple of considerations that we have to keep in mind is for anybody experiencing any chronic health condition or chronic pain, that clinicians are present for only a fraction of a person's time, of a person's life, okay? On average, perhaps less than 10 or maybe 8 hours a year is the amount of time that a person can actually interact with a health professional. Okay. Now, there's some people who interact more and a lot of people interact less, but that seems to be the average. So the implication of that is basically people are managing by themselves 99.9% of the time. Or think of it, 364.5 days a year, people are managing by themselves. Okay? Healthcare professionals aren't managing you, you're managing yourself. Okay? The second important consideration is just being motivated isn't enough by itself. I mean, people can be motivated to do all sorts of things, to, to exercise, to eat differently, to be involved in all sorts of things, but just being motivated isn't enough. People need certain skills, and they need the confidence to be able to do that. And actually, we can help people learn those skills and give them confidence. And the third important consideration is that nearly all outcomes are mediated through the person's own behavior. What that means is, if you're going to get better, it's going to depend on what you do yourself, not what you've been told or what they do to you when you're in a clinic. You're going to get better if you change your behaviors. Okay, so it depends on what you do, not what you know, and not what you think you want to do, it's exactly what you do. Okay? Now, when we consider programs, for a program to be a good program that can get out to the people, to really help people, it has to, have a number of critical characteristics. Okay, first of all, they have to be practical, and they have to be feasible in a number of settings. It's no good having a program that can only be delivered in a clinic and a hospital. And how many people can get to that hospital and clinic? Okay? The second consideration is a large percentage of the population must want to participate. So there's no good having a program that nobody wants to participate in. People must want to go and participate in that program. The third consideration, it has to be effective for long-term important outcomes. Okay, behavioral endpoints and quality of life. Fourthly, people have to be satisfied with it. They have to be happy to participate in it and happy with the outcome of it. Okay, and lastly, the program has to be relatively low cost and cost effective. Otherwise, how will it ever get disseminated? How will it get out there to the people who need it? Okay, so those are characteristics of good programs that we have to keep in the back of our mind when we're planning programs. So now in British Columbia, we've been involved in delivery of self-management programs since 1986, but since about 2000 have been working with the BC Minister of Health, and we do deliver the general chronic disease program and we deliver it in English, in Punjabi, in Chinese, and in Aboriginal communities. Now as well, we realize that not all people like to participate in group programs, so we have an online chronic disease program that people participate in it virtually. So you could have people from all over British Columbia and participate at the same time. Then we have a diabetes program, and we offer that in English and Punjabi. That's a diabetes self-management program we're talking about now. We have a program for people experiencing arthritis and fibromyalgia that we're offering in English. And then we have the chronic pain self-management program, and we're only able to offer that in English now because we haven't had the time and expertise to translate in different languages and deliver it there. And then two other self-management programs we have is one called Active Choices and one called Matter of Balance. And you'll see my coordinates at the end of the presentation, and if anybody wants to know how to take one of these programs, get into them, they're all free. All you got to do is make that telephone call or email. Okay? So in British Columbia, we have I guess we're considered having a celebration of diversity. Okay, we have young people, we have old people, we have people from different language, different cultures, and it's sort of a celebration. And as you can see, people experiencing chronic health condition pains are young, they're old, they're different genders, different cultures, and whatnot. Everybody participates. Okay? So there's a structure in doing this, And the people who actually participate in these self-management programs, we just call them program participants. We don't call them patients. They're called participants. And these programs are delivered by program leaders who we train. Now, these are people usually who have chronic health conditions themselves and who have taken the program, but then they receive a 4-day training so that they can learn how to deliver the program. And they do it always in pairs, and they deliver the program following a specific leader's manual. And then we have a certain number of people who are called master trainers, and they're the people who actually train new leaders. And in British Columbia, we have about, I guess, around 40 master trainers. And then we have a couple of T trainers in the province, and those are people who are able to train people to become master trainers. So that's the sort of the structure of the program. We have very strong fidelity standards and guidelines so that the programs are delivered the way they're supposed to be delivered so that we get the impact that we want. Okay? Now, just showing you about how well this type of structure works. Since 2000, we've been able to offer 330 of those 4-day leader training workshops, and we've trained 3,445 new leaders. And then those leaders, in pairs, were able to deliver 1,581 6-week courses, 2.5 hours a week for 6 weeks in a row. And then the number of people who participated was 17,247. And just talk about dissemination, we were able to get in over 155 communities. I hope this slide is up to date now. Okay? So as well, talking about dissemination and making a needed program accessible to all British Columbians, we had a goal in 2010. And our goal was we'd make at least one of these programs available to every single British Columbian, no matter where they lived in the province. So we thought that we could achieve that by 75%. But at the end of the year, we found that 86% of the populations in communities that had at least 3,000 people had access to the programs. So we were able to get the programs out to the people who needed it. Okay? So much for the way the programs work and the way we're able to get them out to people who need them. Let's talk about Jennifer here. Okay? So as you can see, Jennifer experiences severe headaches, chronic pain. She's been experiencing these for several years now. I've tried several different things, been to the doctor, is on all sorts of medication for it. A typical day is you get up in the morning, you have your breakfast, and you have to go back to bed, take medication. So finally, Jennifer's doctor says, okay, I'm going to refer you to the pain program in British Columbia. Jennifer's relieved, thank goodness. So Jennifer's doctor writes up the referral and sends it down, but then Jennifer's doctor gets a letter back from the pain clinic saying, I'm sorry, we cannot accept any more referrals because we're about 3 years backlogged in referrals. Perhaps Jennifer, perhaps Dr. Jones, you could tell your clients about the chronic pain self-management program that's being offered in the province. So this is the type of person, like a typical person who would come to the chronic pain program. We started offering these chronic pain programs, self-management program, in April 2009. And between April 2009 and December 2011, we were able to conduct 50 of those 4-day leader training workshops. We were able to train 563 people to lead them. And since that date, we've been able to lead 212 of those workshops, and 2,468 people have actually participated in them. Okay? And I have to be quite sort of honest now that of all the programs that we're delivering in British Columbia, the biggest demand is for the chronic pain self-management program. Okay? Now, the chronic pain self-management program, that program would be applicable to people experiencing chronic musculoskeletal pain, whiplash injuries, chronic regional pain syndromes, repetitive strain injuries, chronic pelvic pain, post-surgical pain that lasts beyond 6 months, neuropathic pain, neuralgias, and post-stroke or central pain. But also, it might be appropriate for people with just persistent headaches, Crohn's disease, people experiencing irritable bowel, people with diabetes and also have neuropathy, and individuals who have severe muscular pain due to conditions such as multiple sclerosis. Okay? So it's applicable for a wide variety of people experiencing conditions. Okay? Now here is an overview of what takes place in these programs. As you can see, the program's 6 weeks long, and so many topics are involved each week, like let's say 6 or 7 topics. And you see most of the informational things like debunking myths about chronic pain, what is chronic pain, and you know, conditions like sleep, communication, healthy eating are all covered through the program. But as you can see, there's a couple of things that are covered every single week because they're considered the most important and the most effective strategies. One is making action plans. Okay? The second part is providing feedback on the action plans and also learning how to problem solve. Because remember, people who live by themselves, or people who would live with chronic health conditions, are managing by themselves 364.5 days a year. Also, you see that fitness and exercise is covered in 5 of the 6 sessions, and also using your mind to manage symptoms in 4 of the 6 sessions. Okay, so several topics are covered, but some more than others. And the reason why is because those seem to be the most effective strategies. Okay, now, one thing that we've noticed when we deliver these programs is that the majority of people who come have never even considered, you know, difference between acute and chronic pain, or we'll say aren't aware that there are differences. Most people come think that chronic pain is just the same thing as acute pain, but it just lasts longer. So you see in this slide here, the duration of acute pain is just time limited. You know, you have a toothache or you have appendicitis, a broken bone. You know, we know that the pain will go away as soon as the problem's finished. But with chronic pain, it lasts longer, and the pain lasts beyond the usual time for healing and recovery. Okay, the intensity with acute pain, you know, it's often intense depending on the cause, but in chronic pain, it varies. You know, it can be from mild to excruciating. Location, you know, can be in multiple areas or even in one area. And the function of acute pain is to warn us of danger or harm, but with chronic pain, it doesn't have a survival value. It no longer warns us of immediate danger, and that's unless you have acute pain on top of chronic pain. Okay. Now, we seem to know that, or have good information about the cause of acute pain. Okay, and that's that neurochemicals are released at the site of the injury and in the brain, such as endorphins, to reduce pain sensations and promote healing. But the mechanisms of persistent pain or chronic pain are not well understood. It's thought maybe it could be a disturbance of the natural pain system. You know, there's a depletion of substances like endorphins. And also changes can occur in the central nervous system that keep pain going. Okay, the emotional response to acute pain, well, it subsides once the cause is known and the pain goes away. But with chronic pain, you know, it's associated with irritability, fatigue, helplessness, and isolation. Okay, the treatment is different for acute pain to chronic pain. In acute pain, like antibiotics will cure the toothache or surgery will cure the appendicitis. But in chronic pain, the cure isn't common, and it may be long-term. Okay. Also, the role of activity and exercise is different. When you have acute pain, rest allows healing to take place. But with chronic pain, activity has to be balanced with rest. Okay. Healing of damaged tissues and nerves has already occurred. Okay. Now, the last 2 points are the really important ones: the role of the healthcare providers and the role of the person. So you see, with chronic pain, the role of the healthcare provider is to provide us with what to expect, advise us on treatments, and also advise us on lifestyle changes. And the role of the person with pain, well, we become a partner with a healthcare professional. Okay, they advise us, based on our needs, but we're the persons that we need to manage, because remember, we manage our health condition 364.5 days a year. Okay. This next slide shows the central sort of thesis of the whole program, which is called the pain and symptom cycle. You see, there's different things on here. Like, there's the pain itself, and you see on the circle there's tense muscles, restricted movement, ineffective breathing, there's stress and anxiety, difficult emotions, depressions, and fatigue. Okay, many of us probably think that pain is the only thing that's happening. Okay, that's where it's all coming from. But that's not true. These other things are also aggravating and causing more pain. For instance, holding your muscles tight all the time. Like, if you held your fist tight for a couple of minutes, you'd feel the pain starting. And lots of people who are in pain, restrict movement. They don't keep active, and they don't exercise anymore, don't walk anymore, and that causes more pain. Okay, because muscles shorten, you're less effective. Lots of times we don't breathe effectively, so that even makes it worse. That leads to being stressed and being anxious, which leads to difficult emotions. Sometimes difficult emotions leads to feeling depressed. When we're feeling depressed, we're feeling tired all the time, and that makes the pain even worse. So all these things seem to be implicated here. And the worst thing is, they're related to each other, and they feed on each other. And what we try to do in these self-management programs is to break this symptom cycle at all these different points, so that the experience of the pain itself will be less. Okay? Now, the strategies that we've found that are used in self-management programs be really quite effective. The strategies of teaching people a problem-solving process, teaching people how to use action plans and follow-up, showing health professionals how to use the pros and cons process with people that they're seeing. There's a technique learned in the program called pacing and negotiating medication, explaining the pain symptom cycle, the difference between the two types of pain, and also learning the language of pain and how to measure it, and dealing with depression and anxiety. So let's go over some of these in a little bit more detail. Okay, so remember, this is about the third time I'm mentioning this, but people live by themselves, or they manage their pain by themselves most of their lives. And people are going to experience problems on an ongoing basis, almost daily. So what you need to do is you need to help people learn how to solve problems themselves, because healthcare professionals aren't going to solve the problem for us. They're not going to be around, and maybe they don't know how. So there's a process that we've been using to show people how to do this, and there's 7 steps, but usually people only need to use the first 3 steps. And I'm going to use a case example here, and I'll use myself. Okay, I'm a gourmet cook, and I love cooking nice meals for my friends, and that's really important to me in my quality of life. But I'm having trouble doing this because of the pain that I experience, the chronic pain. Okay, so the first step is identify the problem, and that is I have trouble to continue to cook my gourmet meals because of the chronic pain. Now, the second step in the process is list all the ideas that could solve the problem. So I think of the ideas now. Number 1 is maybe prepare some of the food ahead of time, or even prepare the food a little bit at a time, not all at once. Okay, that's one idea. Another idea maybe is to use some prepackaged foods. Instead of chopping my own garlic, I can maybe buy chopped garlic already. A third idea might be to ask people to contribute part of it, like bring something so we can put it all together. Maybe another idea could be get a person to cook with me, sort of be my assistant, and that might be fun. Another idea might be to make sure I'm using my medications properly to get the best effect. Okay, another idea. Another idea, maybe make sure I have the gadgets, like have the blenders and everything else so I don't have to, struggle myself. And even another idea that a friend suggested, maybe have lots of wine on hand so I can keep offering them glasses of wine so I have more time to cook. Okay? So that's step 2. I've thought of a number of ideas that might solve the problem. And the third step is select one idea and try it. Okay, and when we say select one idea, try it, that means try it and give it a good try. Okay, so the ideas I thought of is, I'm going to ask somebody to come and cook with me, to be my assistant to cooking. Okay, now step 4 is you assess the results and see if it works. And if it works, you've solved your problem. If it hasn't worked, then I can go back to my idea because I have lots of other ideas on that list I can try, and I can see if those work. Now, if still I can't, I've tried all the ideas and I can't solve my problem, maybe I have to ask for help, professional help. Ask somebody who knows. Okay, maybe they have some ideas and they can see if it works then. And lastly, if I still haven't been able to figure out a way of being able to cook my good gourmet meals without experiencing terrible pain, maybe I'll just have to accept that maybe the problem is not solvable right now, but I'll try again in a couple of weeks or so, or the next time I do it. Okay. Now, what I went through right there is a process. Okay, and it's not that you want to solve a problem for one of the persons you're seeing with pain, but you want people to use this process themselves so they can use it over and over in their life, because people will always be experiencing problems. Okay, now that's one of the most effective self-management strategies, a problem-solving process. Okay. Now, the second really effective process is teaching people the process of using action plans, okay? Because we all know that we're supposed to be doing things, but how do you get started? Like, it's overwhelming. Where do you start? Okay? So here's a case example again. I have terrible pain, and I know that if I go walking, if I exercise, that you'll be able to have less pain. That I won't feel it as much. Like, there'll be an improvement. But how do you, start from not walking at all to getting to a point where you're walking regularly? So you use this process. So the step 1 is, it's something I want to do. Yes, I want to go walking. Is that reasonable? Well, of course it's reasonable. I have lots of safe streets and lots of nice little walks around my house. Is it a behavior? Yes, it is. Walking. And it answers the questions. What am I going to do? I'm going to go walking. How much? Well, between this week and next week, I'm going to go walking 2 times. When? In the afternoon. How often? 3 times this week. Okay? So I'm saying I'm going to go walking for, let's say, half an hour, 2 times this week. And then, very importantly, and this is the thing that makes it work or not work, is I say how confident I am on a scale of 0 to 10. This is what's known as self-efficacy theory, the confidence you have. So I'd say, on a scale of 0 to 10, I am 8 confident that I'm going to go walking this week 2 times for about half an hour each time. Okay? Now that's probably the most effective self-management strategy that's known. It's called making action plans and follow-up. Okay? Now, another technique, and this is specifically relevant for healthcare professionals, is trying to figure out what stage a person is to start an activity, to start a behavior, or to change a behavior. Okay? So remember how we said at the beginning how important behaviors were, that outcomes are mediated through a person's own behavior? Well, here's a little assessment that you would use to figure out what strategy you should use. So all you do is you ask, Patrick, how important is going for a walk to help your pain level? How important is that to you? So I'd say, well, it's either not important or, yes, it's really important, like box C or box A. So I'd say, yes, it's really important. And then you'd say, well, Patrick, how confident are you that you can actually go for a walk? Well, I'd say, well, I'm confident. So if I wasn't confident, I'd be in box A, and I'm confident I'm in box B. So that's the best place for a person to be, because readiness for change comes from a theory that says the more a person's ready to make a behavior change, a behavior modification to do something, the greater probability they'll actually do it if they're ready. And ready means how important they think it is and how confident. So I would be in box B because I think it's important and I'm confident. Okay? And so when that happens, if you're a health professional speaking with a client, you would say, that's fantastic, good for you, good for you. You could help me, maybe if winter was coming on, saying, well, Patrick, you're walking, you can go walking now, but what are you going to do when it gets all icy and snowy? And help me think of a different place. Now, if I wasn't confident that I could actually go walking, but I thought it was important, then you'd use those small action plans. Okay? Now, sometimes you actually, in a stage where you'd be in box C, where, no, it's not important, and I don't think I can. Well, all you do, if you're a health professional, is you keep asking, you give people a chance, you keep the door open. Okay, you're non-judgmental here. You keep the door open, you keep asking how important it is and how confident in your subsequent visits. Now, lots of times, people would be in box D. That means I can do it if I want, but I don't think it's important because, I read something that says that people exercise aren't any better off, whatnot. So the people are in this situation right here. What we usually do, or usually have done in the past, have told people the bad things about their current behavior and the good things that would happen if they actually changed. Okay? But what happens then is people start defending their current behavior. And they say some of the things like, I feel fine, or I like my life the way it's now, or at least I'm not a smoker. Or they provide reasons for not changing. I don't have the time. It's going to cost money. I'm embarrassed by my shape. So what you would do is you could use this technique, okay? And you'd say, Patrick, the current behavior now is you have chronic pain and you're not exercising. Okay, you're not going walking. Okay, what are the good aspects of that situation? And you would just be the scribe, and Patrick would tell you all the good aspects that he thinks about not doing anything. And then you say, Patrick, what are the not-so-good aspects of that situation? And then Patrick would list the not-so-good aspects. And when Patrick actually sees the list of good compared to not-so-good, that's a powerful technique for getting Patrick to actually change behavior. Okay? So this is to be used in situations where a person is confident they can actually do a behavior, change behavior, but doesn't know if it's important or not. Okay? Now, here's one of the things that we found in self-management programs to be really, really effective. And it's a little exercise on pacing. Okay? And it's always surprising that people find this so important. Okay, and we go over this. You have to balance activity and rest. And some of the things is like to monitor daily activities to find out how long you can do an activity before you start to hurt. And the way we do this is we ask people to keep a diary for a couple of days, maybe a weekday and maybe a day on the weekend, and note what activities you do and how long you can do them before you start bothering by the pain. Okay? The second thing is to be time-oriented, not pain-oriented. So knowing how long you can do an activity before it starts to hurt means that you can schedule the activity for a certain period of time. Then you take a rest. By being time-oriented, you remain in control of the action, and the pain's not in control. Okay? The third thing is plan several rest periods during the day and stick to the plan. For example, every 5 minutes, take a 5-minute rest for every 30 minutes you're doing an activity. Okay? And if you can't take a break, then just change the activity or change your body posture. Okay? You do another activity. And remember, just changing, something is as good as a rest. The next thing is you rest before the pain gets worse. So lots of times we want to just push through and finish the activity. Okay, push through the pain. But the technique is when the pain starts to escalate, you stop and you rest. The next thing is to break down the activity into smaller parts and take rest period between the different parts. Okay. To avoid rushing, plan ahead, think of the easiest way to do something. And lastly, don't overschedule activities. Okay. Work on developing realistic expectations for yourself. And sometimes you just have to say no to requests. Okay. People really appreciate these tips, and in sort of retrospective evaluations, people say the greatest thing they learned in these programs is some of these pacing tips. Okay. Another thing that's taught in these self-management programs with pain is preparing a pain profile before you see your doctor. Because the worst thing is to be in the doctor's office and say, well, where's the pain? And, oh, I think it's over here. And, you know, to not be able to provide a good description of it. So by preparing this ahead of time, it gets people to be really specific. And when you actually see the doctor or see the specialist, use these words. Okay? That really, really helps the doctor. And also when doctors are asking intensity of pain, use the pain scale. Say on a scale of 0 to 10, where 0 is no pain and 10 is worst, it's 9. So that gives a really clear description of what it is. Okay, good techniques. Now, I'm going to move into working with men. Okay, here is a picture of a typical group of men experiencing chronic health conditions and pain. And when I asked them, you know, when you think about self-management, what do you think of? Like, what's that word mean to you? Okay, it could be different if this was a class of females or women, but these are men. And what did they say? Well, they thought it's group emotions, touchy-feely. You know, oh, it's going to encourage me to take control and do things myself. It's going to tell me what I should be doing or make me responsible for myself, and it's something that's going to take time. And, well, I don't understand what it means. Okay, so, you know, men may have different perceptions of chronic pain and chronic illness than women do. So we're going to look at a case study of Bruce, who's 57 years of age. And Bruce has always been involved in the automotive trade. He's an industrial painter, like paints cars. And he lives low. And he was married at one time, had a family, but he lives low now. And he loves nature. Okay, and especially the part of nature he loves is he loves dirt biking. He and his friend have these big dirt bikes, and they go off for maybe 5 days into the wilderness, and he really, really enjoys that. That's his quality of life. But Bruce had an accident. You know, he smashed his leg 2 years ago. And after, like, the initial pain went away, he was left with lots of pain, and they said it was damaged nerves in his leg. And Bruce describes this as, like, getting electric shocks. It's burning. It's like a lightning bolt going through it. Sometimes it feels like an animal gnawing away at it. Or sometimes it feels like there's ground glass in the joint. And it gets worse when the weather changes. And when it's just normal, not aggravated so much, it's just like a low burn. Okay? So Bruce is worried about his future, you know, his health, his work. And also he feels really vulnerable, you know. He feels the little boy inside him, feeling not so sure anymore. He's afraid of the way it's affecting him physically and mentally. He's becoming an angry person. And he had a perception of himself, and he felt that he was losing a lot of what I am. And he was going between a balance of being certain of not doing what others had done, but afraid that he was going to do whatever it took to be able to function. And that meant use alcohol or drugs. Okay? So he also felt he was being treated at the lowest level. When he went and saw his doctor and asked for stronger pain medication, the doctor said no, because you'll get addicted. Bruce said he didn't want to walk around in the buzz. He didn't want to be stoned. He just wanted to be able to manage. And we all know that when we wake up in the morning with a severe headache, there's a certain point where we can actually go to work and function all day long with a headache, but also there's a certain point where you can't do anything. Bruce just wanted to be able to function. He felt he was like a dog chasing his tail. He was being consumed by it. And he said he wasn't being very active, feeling like a slug. And he was feeling depressed, and he felt emotions like anger, fear, frustration. Okay? So he saw an ad in the paper, and it said chronic pain management. And he said, wow, chronic pain management. And that's the first time he's ever heard the term chronic. And he also saw there was a logo, Ministry of Health and University of Victoria. So that instilled some confidence because he knew it just wasn't a fly-by-night company coming in to, provide treatment. And he felt glad about it because it was a course in the direction that he wanted to go in, like management. Okay, and he felt a bit relieved too because he said it could have taken him a lifetime to find out that he was able to take a program like this. So at first, when he started to participate in the program, he felt he was out of his age group because people a little bit older, people a little bit younger, but soon he put it away. He put that feeling aside, and he realized that other people were even experiencing worse pain than him, and that actually made him change the perception he had, his perspective. And he noticed other people were still managing, and he said other people could laugh, and when he laughed, it didn't hurt so much. He felt a little bit relaxed, and actually everybody in the course said that at sessions 5 and 6, he looked like a different person. Okay, so the highlight of what he got out of the program, and this was with a conversation with him afterwards, is he became more proactive. He went and spoke to his doctor about medications, and finally he said he had to go and look for another doctor, and he did find another doctor where there was a better trust between them, and he is receiving a stronger medication, been able to function. Okay, he says he's using techniques to help him stay calm, and he said the techniques even help him to relieve his migraine headaches. Okay, he said generally, when you go to these self-management programs, you learn a system, techniques, and you don't have to use them all, but you can weave them into your life so they keep the changes at a minimum, so you can still be the person you are. And he said the quality of life was his top priority, and he believed he could still do things he wanted to do, maybe not the quality of it, but he'd be able to do it and age gracefully. Okay? So his slogan was, give me the box with the right tools and I'll make it work. So Bruce went back to work. Okay, and this is the kind of work he does. He works in industrial painting, and he stops by the office once in a while. And the last time he stopped by the office, I said, well, how's it going? How's it going? And he says, yeah, I'm watching my diet because I know that there's some foods that I can eat that make it worse, make the pain worse. And I exercise, and I'm aware that I exercise. I do breathing exercise and those pacing techniques. And also, I'm able to realize the signs and use of medication and know when to use it. I use that problem solving a lot. I don't get in a tizzy. When I'm in pain the night before to go to bed, before I go to sleep, I'll just know to take the medication. I'll be fine in the morning. And I have a really good relationship with my doctor now. And with meds and quality of life, I know medications may have effect on my body, but quality of life is the most important thing, and it's a delicate balance between using meds and my quality of life. And lastly, he said, if I had anything to tell anybody, I'd say pain isn't proud. Seek help. Okay? And he said, realize that there's not one solution, and don't believe people who tell you that they found the one best solution. He said, because it's a combination of doing many things, and he actually says he sees pain in a different way now. So that's the story of Bruce, and that would conclude the webinar. Okay?
Yeah, thank you, Patrick, very much. That's a wonderful overview of the program, and the program's been around long enough that you have a lot of wisdom to share with our audience here. Now, I am just going to give people a few minutes to put questions in the question box, and if you don't mind, we could handle a few of the questions in the remaining time. I'm just curious, just while we're waiting for people to send their questions, I wanted to know what kind of, are you actually doing training with doctors in some of these techniques for professionals?
No, we're not training doctors. We're training people to become leaders in the self-managed programs. I have in the last several months made many talks to healthcare professionals, especially doctors groups and whatnot, and people are open to that. And I guess I have to say that especially family doctors, I think that they realize that the techniques that they know and can use with people to help people with chronic pain are sort of limited, and they're open to learning new things and are really quite receptive.
Well, that's good to hear, because I know that is a question. That's why I was asking. That a lot of people feel doctors, because they're busy, and a lot of them haven't had specific training in pain management, so it makes it difficult. And that's clearly one of the things that is covered in the program, how to talk to doctors. And I think those resources that you mentioned, where people can actually define their pain for themselves and taking that into their doctor, can help a lot.
That's right. And you notice what Bruce said at the end. He said it's not just one technique, but it's using several strategies at once to be able to make your pain manageable. Bruce still experiences pain, but it's at a level now that he can live and have a decent quality of life.
Exactly. Yeah. Are there courses offered like this? Do you know, we do have some listeners that come from other parts of the country, like Ontario. Are there other regions and provinces where this is being offered?
Yes, this is one of the programs that are sort of, it's called the Stanford University Self-Management Program, and I believe the programs are offered in Nova Scotia, Quebec, Ontario, I believe Manitoba, I'm not 100% sure, I think Alberta. So different provinces have these self-management programs as well. And if anybody from another, like for instance, if somebody is traveling here from like Nova Scotia and want to find out, we could easily tell them who they contact in Nova Scotia because they're available.
Okay,
all that information. Yeah.
That's good. So people can contact you about that. And we'll try and put up on the website the link for the Stanford program. I'm just looking through some of the other questions here. There's some positive comments from people that have taken the program.
Oh,
and I will mention as well that the Arthritis Society offers the Arthritis Self-Management Program and a 2-hour chronic pain management program.
Yeah.
And
yeah, the chronic pain program I'm talking about here, though, is a 6-session, 15-hour program.
Right.
Group program, yeah.
Yeah. Now, have ICBC adjusters being informed of this material? Do you know?
I believe so, yes.
Okay.
You know, over the years, we've tried to use every single method of informing healthcare professionals, doctors, adjusters, you know, insurance people. You know, it's an ongoing battle. So if anybody ever has an idea that we haven't tried, or they think we haven't tried, just let us know, because we'll probably say, well, we do that.
Yeah, after these many years, I'm sure.
And as I said, the demand for this program is growing just in leaps and bounds. They're even using the techniques we use now.
Yes. And you've done some studies, have you, to follow up after? Yeah.
In most of the self-management programs have been extensive evaluations. Now, the chronic pain self-management program has undergone 2 evaluations showing some good results. And currently now, when people participate in these programs, I do collect questionnaires and containing data on the health outcomes and whatnot, and I'm in the middle of an evaluation to see how it works.
That would be very interesting to see the results. Now, for professionals who are wanting to offer something like this, is it possible for professionals to become actual key trainers?
Well, no.
It would have to be people that have gone through the program, is that right?
Well, let's say that the research that we have shows that people who are doing this as a volunteer are just as effective as health professionals doing it. Okay, so there's no difference. The difference is the cost. You know, if volunteers, like all we're saying about volunteers, I mean, they could be nurses, it could be doctors, could be anybody else, but they're doing it on a volunteer basis. When they get involved in this program and deliver it, then let's say the cost per each person in the program would be like, let's say, $220. Okay, that's the whole infrastructure. But if healthcare professionals did it and did it on the payroll, you know, as part of their job, the cost would probably go up to $2,500 a person. And I sort of think, well, why are we like just making that change to get health professionals to do when peer leaders can do it just as well?
Oh, I think it would be more in the sense that they would have some additional tools to use with people that they're seeing, rather
Okay.
than, you know, being
Okay.
paid to do it. Yeah.
Yes, but one thing specific about these type of programs is these programs have very strong fidelity standards, which means that you have to do the program the way the program was developed. You can't change it around and can't add a whole bunch of professional things, because then it changes the nature of the program.
Okay, I see. Yeah. Yes, people are asking if we might be able to have your presentation available, so we can talk to you about that.
Okay. Now I have to say that, like in lots of places, health professionals are actually learning how to lead this program and delivering it. Okay. Now all they would have to do is contact me, and I would sort of give a better explanation, and we talk about it. So it's not a priority to have all these programs delivered by health professionals. It makes more sense to have peer leaders deliver them.
Mm-hmm.
But in lots of places, lots of provinces, health professionals are involved.
Mm-hmm. Yeah, it's the more information they have, the more they're able to support the patients they see, even if it's not through the program.
That's right.
Yeah. One question here is, could you tell us a little bit about what Active Choices offers?
Sure. Active Choices is a different type of program. Active Choices is a program for people who have stopped being active in life. You know, as we get older, you know, some of us, when we get into our 50s and early 60s, we just stop being active. Even though we want to be active, we want to maintain like walking or exercising, but it's hard to actually get started and to get back into it. So in the Active Choices program we have trained mentors. And what a person would do is we would hook a person up with one of these mentors, and they would meet with that mentor once, and then over a 6-month period, there's a process where the mentor helps this person become active again. Again, this program came from Stanford University, and it's really well evaluated with really good results. And if anyone's interested in that program, just phone our office here or contact us.
Okay, and that, well, the website is up on the screen there, so people can note that, and we'll also send that out with the phone number as well. And one interesting question is whether there are programs like this that are geared to children who are experiencing chronic pain.
Unfortunately, I'm not aware of any.
No.
There is one program that's been developed and implemented in England to help children experiencing chronic health conditions. But, you know, we have tried over the years to try to implement, but it hasn't worked. You know, we don't seem to be effective doing it. Mm-hmm. You know, I'm not aware of any program in the world that does that. And also, you'd have to look and see if the techniques that work with adults would also be applicable for younger people. I know we did try to do that in BC a couple of years ago, but we were without success.
Do you find time commitment is an issue for people? For example, people that are less inclined to commit to a program over that period of time, compared to something that might be 1 or 2 evenings?
Well, I don't think there's a problem. Okay, as I said, there's more demand for this chronic pain program than we can meet, that we can satisfy, and there are 6 sessions, 2.5 hours a week for 6 weeks in a row. So that's a total of 15 hours. Now, when I look at my statistics of program attendance, I see the average attendance is 4.3. So 4.3 sessions out of 6, and that's extremely high, especially when you compare it to other programs. Mm-hmm. And you know, the sort of rule of thumb is to be able to say you complete a self-management program is when you complete 4 out of 6 sessions.
Exactly. Now, I think we might have time for just one more question, and this is one I had as well. And I guess the chronic pain program is online as well, is it?
No, it's not online.
Oh, this one is not. Okay, because I was going to ask if, and somebody else here asked whether there was any difference in the outcomes with the online program versus the in-person.
No, there's no difference in outcomes. The online program is just as effective as the group program for chronic disease self-management.
Okay.
Maybe in the future there might be an online program, but at present there isn't.
Right. Well, I think just from the responses, and I'll forward to you, Patrick, some of the responses to people who have taken the program and got a lot out of it. So I can see why the demand is growing, because there's a lot of people needing something like this, I think, in our communities. So I thank you for what you're doing and have been doing over the last 25 years. And I thank you as well for closing our series with your very interesting presentation today.
Great.
And I'll just let the audience know that there will be an evaluation link in a follow-up email, and we'd really appreciate your feedback, and because we will be probably offering other series in the future, so it all helps us to know what works and doesn't work. And as I mentioned, this is the final webinar in this series, and we're very grateful to all the speakers who have shared their expertise with us over the past 6 months. And we'd like to thank once again our co-sponsors, Pain BC and the Canadian Pain Coalition, for their ongoing support and helping us to reach a wider audience in BC and across the country. So please do check our website for updates on new series that may be offered in the future, and as well as new resources that we are putting up there all the time. And I just wanted to give a special shout out to Tanya Hyde, who's not here today, but who's been hosting the webinars in this series, and for making the technology always seem so simple. So thank you, everyone, and I'm sorry we didn't get to all the questions, and please do contact through the website the self-management program if you have specific queries. So Patrick, thank you once again.
My pleasure.